Hello, Assalamualaikum. Good morning. Can I know who is in charge for this session? What we should start at 9, isn't it? Are we going to wait for further attendance? Is there any Encik Makno is there?
Ya, doktor. Boleh start pukul 9?
Kita nak tunggu lagi ke?
Saya rasa boleh start dah pukul 9.
Pukul 9. Berapa orang semua sepatut ada?
Kalau ikut satu.
Ni baru berapa orang?
7.
Ni baru 7.
7 orang.
Sepatutnya berapa orang?
Kalau ikutkan yang ambil 7 orang saja. Ada lagi tapi yang tu sebagai student tu dia boleh masuk untuk tengok je.
I see. So yang course ni 7 orang. Cumanya kita buka pada semua lah.
Kita buka untuk kelas dia orang juga, cuma kelas dia orang tu 3 orang tu dia tak ambil tahun ni course tu. Tapi Dr. Lee bagi dia orang masuk tengok juga.
I see. So kira ni dah cukup 7 orang untuk proceed lah.
Doktor boleh proceed lah.
Okay. Alright. So saya boleh teruskan
Boleh teruskan.
Okay, masih. Right. So welcome everyone. I will start sharing my my screen. Okay, are you seeing the presentation slide or the speaker slide? Can anyone confirm? Hello?
Yes, we have seen we're seeing the presentation slide.
Sorry?
We are seeing the presentation slide right now, Doctor.
Okay, you can see clearly. All right, thanks for confirmation. All right. So welcome everyone. So today's I will share with you important aspect of research, which is the human research ethics management related to research that you may some of you may get involved afterwards. All right. Okay, I'm Dr. Azlan. I'm the chairperson for USM Research Ethics Committee, Human Research Ethics Committee, which is JPEM, Tatakuasa Etika Penyelidikan Manusia. All right. So, so the content of my sharing today is about why do we need to do research, ethics versus research ethics, what is human research, USM Research Ethics Policy, and the main of it is how does Japan came about and the review process related to human research proposal. So I think every one of you know this. Why do we do research? If you are staff, then you need to fulfill the KPI. If you are a student, then it's part of your dissertation, and so on. So, but anyway, whatever is more important is about knowledge, which you get new knowledge, you can share your knowledge. It is about knowledge, right? So these are the collection of what do you call reasons why people doing research. I think you may have your own list of wishes or aim. Why do you need to do research in your own understanding? But I guess if you think about it, really you want to expand your knowledge base, give you a latest information from your literature review, and then you're looking forward the methods that you're going to use, all right? And maybe later on when you present your research, you get what you call input from other who review your research. Okay, when you describe your result, when you conclude your result, you share your result. Okay, and it also help you to be prepared of what are you going to up the gains. For example, in the case of talking about disease, in human disease, maybe you are exploring a new way of detection, okay, or mechanism of disease, right? And that's where you go for like FRGS kind of grant, for example, right? So you more focus on the basic science of the disease. With that, it builds your credibility as a scientist. And it also helps you define your scope rather than you become too broad and become jack of all trade, right? So, and it gives you a better judgment with the input that you do, the kind of guidance for you, right? And it also open up new horizon for new ideas, and that may people never think about it. That may possibly help in problem solving of certain issues that we encounter, right from understanding the disease, diagnosis, management, and so on. Okay, and also encourage the curiosity of you. So I think ethics is quite everyday kind of things. Somebody says it's a moral principle. These are the list of definition you can think of. You can choose which one is suitable for your practice and your area of what you call countries, cultures, and so on. Basically, it's about values, right? And moral integrities. Okay, what choice you choose, right? Whether you are dealing with issues of fairness and responsibility. Okay, right. This is basically the things you may want. So, but people say that ethics is from the heart. Ethical conduct literally means simply doing right thing and right time. Okay, and it's common sense, right? People say, but the problem is not everybody understand what we mean by common sense, because people may understand in different perspective, right? And forgetting the other perspective. So, and what more in research, sometimes we do focus to what you call engrossed with the scientific rigor of it. Then you miss some of the principle of participant right, for example. But so that is why if you are not careful, you may stumble with so many issues at the time of doing the research. And the worst thing is when you, if you don't realize it and you only notice it or discover it at the time when you submit your thesis in exam, for example. So every researcher has to read around what would be the potential influence in regards of your research that you're going to do, be it relevant to human or not human. Okay, because the final responsibility is researcher itself. Whether you do on your own, your supervisor, we grow as a researcher. So nobody else should know better to your research around your research issues, the potential issues, except you yourself. Okay, and don't forget that if you do research, you are not alone. You may have other researchers as collaborators, and other people that are interested in your research. For example, sponsors, okay, be in the community, institution, okay, or government sponsors, okay, private sponsors. These are the common ministry that offer grant for research in universities. And also not to forget policymakers. Policymakers, okay? It could be from NGOs, all right? Ministries, government, or industry, in private sectors. And for research related to medical and health, important to note that these are the research authority that govern and monitor research activity, especially NPRA in Malaysia, or the Malaysian version of USFDA, the NPRA, National Pharmaceutical Regulatory Authority. because this entity, if you're not careful and you violates their regulation, they have all the legal powers to shut you down or suspend your research activity. So you have to be careful. And things can get more complicated in the new era in research because of there are more ways of integrating the research. The cross-discipline, cross-border is already there for many years, many decades. And now we are seeing increasing interest in genomic research. And what more, or also research using social media as a tool, which has its own challenges and require a separate discussion on this. So if you are a lecturer pursuing further study, then supervising research is also an integral part of doing research, whether they are main or co, and whether you are coordinator of the research, and whether you are the chairman of the research program. But why we need ethics approval? Institutionally, yeah, because you demand it. For example, if you are a student of USM, staff of USM, USM and also other university, demand for ethical approval is part of the research policy and is part of the grant requirement. And for if you are staff, then it's part of your promotion. Okay, that you need to have this clearance. But if you notice that if you have a better research, you get better clearance, you get clearance for research, you get successful, secure of your research and you can complete your research. The next research that you're going to do is going to be much easier. You get better grant, to get better equipment, better reagent, and you may be able to hire more research assistant and present your research finding. Okay, more. Of course, those days we get to travel in presenting research, sharing, but now probably we are just many limitation on that. But now the spending and for the grant is more in terms of publication fee, for example, publication processing fee, for example. So that's require different degree of grant utility. Okay, and for students who submit their thesis, you need to provide evidence of ethical approval. We have seen not many, a few occasions where students been barred from exam and have to redo the research because of these issues. Okay, and for research-related publication, there's so many journals nowadays have demanding for ethical clearance, even if it's case report or audits. Okay, right. And what most important, I guess, is that our research is done in accordance with acceptance, ethical principle of human research. Then only your statement in your publication you put there, this research is done according to human research ethics, what they call clearance based on Helsinki Declaration. That is only appropriate. There's no point put that declaration, but there is no appropriate process of what they call confirming that, right? So when you should plan to get research article, but of course it should begin from the starting for your research. From the screening, not only at the time of starting the research, but planning your research proposal. You should have that in mind. Okay, right. So then, what does human research consist of? You can get this definition from the online. All right, you can always go through this. We have our definition is on our website as well. So basically, any research that require direct interaction with the human subject, or when you utilize specific research human data. Okay, data here. So this one is of course direct, collecting sample, conduct survey is direct, changing. The research may change the participant environment, administrative means, okay, this is direct, interview is direct, okay? Or administrative, even psychological test. Many people think this is, many people don't think is required. Yes, it is required, right? Even conducting a focus group discussion, just like component of the qualitative tools that you use. Okay. All right. So you can always also use this online decision tool. This is from US NIH that's provided kind of screening. So you can use this. Right. I find it is quite useful for students. Right? So what does USM says about research policy? This is initially it was published in 2018 and is been what they call renewed into 2020. So basically all it says here, all research related to human or even animal need to follow the research ethics code and guidelines. Okay, by that is what you call endorsed by universities. So kalau human research, Japan lah. Okay, alright. So this is about genetically, so like biosafety kind of research. So in a simple way, any research that is done by researchers that is either because of the principal investigator or researcher is USM student or staff, then it has to come from Japan. Or when the subject coming from USM, either staff, patient, or students need to get clearance. Or whenever there is funds coming from USM, need to get clearance. If the research is conducted in USM just for the sake of running the test, for example, but the sample is not from USM, okay, the subject is not from USM, the researcher is not USM, is a kind of the test is only done in USM, then that's not required. Okay. Or the fund is not from USM as well. But there are common exemptions. A typical one is whenever there is, of course, this is quite clear, when it doesn't involve human sample, human subject, or human data. For example, you do in a cell line, for example, systematic analysis, systematic reviews or meta-analysis. You just get data from published data and so on. Or purely audit, which not going to be published, is only to be used as part of the quality assurance improvement. Then it's not required to be. But if you think that quality, the audits will possibly be published, then it's better to get it reviewed by the ethics committee. Okay. All right. So based on this criteria, your proposal can be exempted. But how what is the procedure of getting formal exemption from review? So you need to still submit your research proposal, and it will be reviewed by chairperson. At the moment, it's by me, and then with guided by the criteria, then we will produce the letter of exemption. Okay. If you're not sure, you can always submit and request for possible exemption. This is important reminder. When you submit, you need to submit the full proposal rather than just abstract, because there very limited information can be derived from the abstract. Okay. So what is a Human Research Ethics Committee? There are a few terms that you may have encountered. IRB, which is Institutional Review Board. There's also independent EC, IEC, Independent Ethics Committee. This is not common in Malaysia, but in US, they have an independent ethics committee, be in a private or government, in which they may not themselves have a research activity in their institution, but that's why you call it independent. But they can review research who submitted to them, and their approval can be used for any institution that have endorsed their approval. So contohnya, if you kan US, especially the US lah, they have many states. They ethics independent ethics committee need to be accredited or endorsed by various states that yang the research is going to be done, barulah that approval is valid or accepted. So the main objective, kalau so for Japan is defined as IRB for USM, Institutional Review Board. Okay, the only IRB for USM. The objective is to protect participants. That's the main objective. But doing so, actually, you are protecting the researchers and also protecting the institution. But by reviewing and commenting, make a suggestion. So in regards of the beneficiation of research, there should not be maleficent, and by upholding autonomy of the subjects. And to be fair for the subject, if, for example, you have many groups, many arms of the study, for example, even though you have one arm of the study, you still have to be fair for the participant before they while they are involved in your research activity, and have to be just lah. Okay, right. So a bit of history of Japan USM. It started in PPSP 30 years ago. More than 30 years. 30 years lah, 1994. Okay. Started with the group of medical research and health research. And later on, because as USM is preparing to conduct a clinical trial by drug company, it has to be registered under this entity, which is called Office for Human Research Protection, USA, right? And they have to fulfill the certain criteria in order to be registered there. And then as we move on, it becomes separated as part of the standard recommendation. The best way is to separate a research committee dengan ethics committee. And later on, 6 years later, it is directly under VC that in which the whole USM will be covered by this research ethics committee, which is called Japan. And these are the milestone and achievement that we have locally by MPCB is the old name of MPRA, and MPRA National for Malaysian National Pharmaceutical Regulatory Authority, and MPCB is National Pharmaceutical Control Bureau under MOH. Like any research related to medical and health, they will have their legal power to what they call monitors. Okay. And later on, we get recognition for internationally. SICA FERCAP, I will touch a bit later on. It's under WHO initiative to recognize, to have a proper recognition of the way human research is done throughout the world. Okay, and recently we get the extension of recognition locally by MPRA as well as by FERCAP. This is our structure, right? We it has to be Japan has to be free from administrative undue influence. So that is why the process of the review should be clearly stated in the SOP and so on. They should not be influenced by any administrative what do you call body in USM. So in Japan, the members consist of people from different research expertise. They may include the medical and health science scientists, and also from social behavioral sciences as well, such sports science. They can be member and also non-member. meaning they can be USM staff or non-USM staff. They can be affiliated or not affiliated to USM. Okay, and also we have a couple of person who are experts in the research methodology, either in the social science group area or also in the medical and health science area. We also should fulfill the gender representation. They should be also non-scientific members and also layperson. The person is from the community lah. This is part of the international requirement. Since most of the research in medical and health activity in USM involving sample from HRPZ, so we also include representative from Hospital USM as well as Hospital Raja Perempuan Zainab II Kota Baru as part of the committee member. So these are the structure. Okay. All right. We have one chairperson, 3 advisors, and we have 6 panel chair. Right. 3 in Kubang Krian and 3 in Penang. So these are the other subcommittees. Site visit, SAE, Serious Adverse Event Committee, is part of the requirement by WHO FUCA. As well as the site visit. These are the main person that you always be the key person that you communicate, right? Overall, Cik Bazlan is the chief of the staff, secretary. Whereas in Health Campus, we have Puan Siti Fatihah, Puan Abda, and Cik Haris. Whereas in Penang, we have Megat Fitri and Nona Nadia. These are our office assistant. So all these members are appointed by VC, also an independent reviewer. And then they have to undergo training. Okay, right. Basic training and additional training. Okay, the training can be internally, especially for SOP for Japan process, and also externally by various authority and bodies like FERCAP just now, and also authority from MPRA and GCP. Even though the members are layperson, they have to undergo GCP training, and that should provide evidence of training that they have attended. At the moment, we have closely about 40 members in Penang and 15 members in Health Campus. Same with the review, there's about 40 in Penang, 40 in Kubang Krian. So altogether about 160 in total members plus independent reviewers. Okay. Who are they? They are basically, both of them are expert in the field, and their role is as a primary reviewers. They review the proposal that submitted to Japan, then they provide their comment and recommendation. Okay, I will touch about that in the review process later on. The difference between independent reviewer and members is that they do not vote, and they cannot vote. Decision making during the review process in the meeting, either expedited or off the board. Okay, and this is what I mean by seeker for cap. It basically is an initiative by WHO for different region. Like for this one, like in South Africa, you have PABIN. Okay, for FERCAP is one of the largest areas that covers under countries, number of countries that's covered. Okay, so as you can see here, recognition by seeker FERCAP in Malaysia at the moment is only 4 centers. It's first achieved by MREC, followed by Japan. I think it's 2013, we 2014, and UMC, and then UPM, UPM Ethics Committee. So this is what I mean by the Western Pacific region in Asia. Cool. So this, sorry, repeating the same thing. All right. So a bit on MPRA. They do inspect us regularly every 3 to 4 years. So these are the regulation and rules that have already been gazetted and established on how what are the minimum requirement for ethics committee to follow, right? If not, then you may end up with penalties. Right? So don't play lah. So these are the things, the directives and so on. This is Nasim. Nasim is kind of something like NGO. It's the coalition between various ethical committees in Malaysia try to harmonize the way we review ethics proposal in human research, established by MOH, MREC, and USM that time. Okay, and this is what I meant by the review and audit by MPRA and by SICA-FERCAP survey, right? So alhamdulillah, we managed to secure the recognition, accreditation by them for the next couple of years. So how does Japan work? As I said, Japan is an IRB of the USM. So you can divide the step into pre-submission, prepare for the submission, anti-submission. Then once the submission is verified, then we got it goes into the review process until the first decision. Okay, the first decision either made during the review by full board or expedited. For those yang review submitted and then it's considered as exemption from the review, then it will be exempted. Okay, so decision exempted is much quicker, about 2 weeks, the latest. And then not to forget, we also there's a component of post-approval review, whether it's reject submission, whether it's there's amendment, continue review, SAE, especially if the research is intervention. So and there's a various form you should submit. To be clear, for any document that is relevant to your research activity, be it flyers, okay, forms, diagram, please do submit. Right. So these are the website of Japan for the submission approval process. Okay, there will be different submission pathway for students and staff. Also for undergraduate, that's much easier pathway because they are supposed to do very low risk kind of research. Okay, all right. Alhamdulillah, we do have online submission nowadays. Last time you need to be paper based. There's whole lot of paper stack need to be submitted to Japan. So alhamdulillah, in the last couple of years, we managed to establish this system developed internally by our VPKT, even though they are very tight with their duties. We managed to have that. So, okay, this is the first landing phase. At the moment, the only that is fully go live is a submission audio system. The next 3 is in the process. Hopefully, we can achieve these 2 systems by end of this year, inshallah. So basically, submission of proposal involves submission and the staff check and the completeness of the submission. Then, if it's complete, based on the category of research, category of the researcher itself, okay. So when the secretariat check and is complete, then only the timeline is start ticking. So then it goes to the chairperson and the panel chairs to decide to assign who will be the reviewers and what kind of review, whether this is expedited, whether it's full bar, or whether can be exempted, right? And afterward, review will take their time to review and make a recommendation. How long? 2 weeks. I will go to that later. Then after that, they submit their comment and they will discuss in either expedited review or full board review, depending on the decision that was made according to certain criteria at this point. So then after this review, then only the first decision will be made. Okay, either approve, modify, major modification, minor modification, or resubmission, or disapprove. Okay, so this is the gist of the submission approval process. Okay, so this is important for researchers, including students, to ensure the type of project they're going to do. Whether, number one, of course, before the intervention, whether it's human research or not, whether it's required to send or not. Okay, if you're not sure, then you can always send. Intervention dan intervention, whether you need informed consent or not, ICF informed consent. Which category of research you are, either has related science or social science. Because we do have some template that you can use for the research proposal protocol and as well informed consent. Different for template for health related science as well as social science. And we also need to know whether who the research coming from, where is the researcher coming from, whether either USM or not USM, or whether it is coming from Penang or whether it's coming from KK. Okay, and the site of research, whether in USM, outside USM, or both. Okay, whether and then is there any ethical approval has been achieved before this, has been obtained before this, and then if it's not obtained yet, is it required or not, based on kalau MOH punya institution, then is it required. Okay, we'll go to that later. And for students, be sure that the proposal has been discussed, at least at department. Best is at department and the school. The reason being is that some of the comment basically is a basic comment that should be corrected or modified earlier on before it reach to Japan punya committee. Because in many situations, bila when the student present, the supervisor pun become embarrassed because they kata, this one has been discussed. Why don't you the student make a correction? We don't want this to happen. And you got relationship with your supervisor. Okay, so be sure that all the recommendation that you have presented dekat department tu has been done, has been addressed. Okay, and it has to be documented. List of attendance, what are the correct issues that has been raised by the during the discussion, and whether it has been addressed, and then only HOD sign. Okay, not just simply sign. All researchers are requested to read and understand the assessment form as a guide. Even though we don't use the assessment, researcher are not required to fill up the assessment form, but what we are going to, what we feel that if you go through the assessment form that is going to be used by reviewer, at least you prepare your proposal or your informed consent if relevant, according to what are the areas that going to be assessed. So that and you can use the template, but make sure you make necessary adjustment, modification. Don't just copy paste. There are a few things that may not be relevant to your own project. Okay. Okay, this is an example. Kalau postgraduate in PPSP, we do have the guidance preparation submission dissertation. Okay. You can have a look. This is freely available. Okay, online. And kalau you tak ada dekat your school lah, right? And there's also one this reporting guide. There's a hub for this a quarterly. I find very useful. Okay, this is a hub where it lists down all the how do you prepare your research proposal according to different type of research. For example, kalau it's a randomized control trial, then use the consort document. All right. I can guarantee you, if you follow this dia punya guideline carefully, inshallah you won't have any much problem. Okay. Even observational study, you have stroke document, systemic review, PRISMA guideline. Okay, and interestingly, this apa ni Equator ni dia regularly updated kalau ada baru. Okay, regularly updated. One of the common issues that we encounter for especially in medical and health research is that they are not clear. Many students or some of the they are not clear between what require to be registered under MMR. So this basically is speculation that has been going on since many years ago, more than 20 years. More than 13 years. Okay. So it is mandatory for all human research involving drugs, even though it is observational. Kalau interventional lagi lah. Need to be registered. Register in MMR doesn't mean it has to go MREC, because MREC is the Ethics Committee of Ministry of Health that review and approve. Tapi NMR is the registration only. Okay. So so kena register, and it is made mandatory by MPRA. All the research must have registered and ada research registration number tu. So mana at the time of submission tu you all dah siap, all of you have already registered with the dedicated registration number. Okay. This is the common understanding I mentioned just now. MREC is the ethics committee. NMR is a registration punya hak. Registration. Okay. What more kalau your research involve need to be approved by medical device authority using new medical device not registered yet before, then kena ada specific approval from medical device authority under MOH as well. Okay, common issues for postgrad. Okay, this is thing that I mentioned earlier on. Must have proof that your research has been presented, discussed in the department. At least kalau tak schools, mesti ada kat department. At least with kena produce attendance list and recommendation correction made and endorsed by HOD or head of program. So another common issues is they're not clear. So they're not clear within interventional or non-interventional. So basically, kalau if the research activity just observing the response of standards procedure, even though how invasive is the procedure, but the procedure is done according to the clinical indication, for example, then it's still as observational. Walaupun the operation tu laparotomy ke apa ke craniotomy in the brain or whatever it is, but you don't do something outside the standard clinical practice indication, you want to observe certain parameters, then okay. Alright? Still observational. Interventional, on the contrary, it can be psychological intervention. Okay. Right? Or intervention, of course, drug everybody knows lah. Drugs, procedure, surgery, everybody knows. But even psychological intervention, right, is still considered intervention. Or social in community. Some caution that is, kalau you nak observe, but using different methods or different indication, contohnya lab test apa semua tu, please consider the you bear the budget for the cost of that test. The test may be standard, but the indication you use in this is not standard. For example, you want to do echocardiogram for patient undergoing hip surgery, before hip surgery, after hip surgery, and then repeat another treatment. Even though echocardiogram is standard, but it is not indicated in that way, before surgery, after surgery, and after across the board. Unless kalau ada indication patient develop heart failure, patient, that's different. That is standard indication. So the gist is you need to know what is the standard practice of that particular test, okay, as compared to what you're going to do. And this is another thing, what coming for university research, what is the standard of care? You need to know what is the standard of care for that particular aspect of research that you want to associate it with. Okay, compared to the new approach that you want. Kalau you new approach tu kan interventional lah. So this is one of the component, and we call it clinical equipoise. This is the assumption that is no one better intervention to others. So this is what we call under the justice and fairness to the subject. If it's already known one method is much better than the other, then it's not fair to expose the other group with different intervention, for example. Okay, and this is another thing that is either interventional or non-interventional. Duration of even for each participant. Kalau ada each procedure. Kalau ada multiple procedure, and each visit, and the whole project. This is common missing information. Selalunya student won't miss duration of the whole study, but this one many miss to put there. And to declare and address conflict. Conflict of interest is not something totally no. You can still have conflict of interest, but you can do the research. But you have to identify the conflict of interest, and how do you address that to minimize relevant vulnerability issues between your potential subject to yourself. For example, you are the treating physician, for example, okay, or you are the lecturer, you are the supervisor, and you want to do studies among. How do you minimize the vulnerability issue? Okay, make sure they are free to involve or get not involved. Okay, so another important information is if your dissertation is part of the bigger project, maybe FRGS or LRGS, you have to declare you're going to use a grant for another project to cover the cost of your project. You have to declare, right? This is to avoid unnecessary confusion. Because we have so many proposals that coming to us, about 800 to 900 proposals a year. Okay, and informed consent, you need to know. You have to read about whether it's required or not, and what kind of informed consent you have to put. Although we have templates, but that is not all. Okay, for research involving it's already recorded data using secondary data, then it does not need informed consent unless there is no way for you to publish that data without identifying the person. For example, if the disease is such a rare condition, if you publish your research, there's no way you can avoid of identifying that person or the family. Then you require consent. Okay, even though it's recorded. Okay, we pause for a few seconds. Any questions at the moment before we proceed? Okay, so then we go to post-submission. So bear in mind that the previous slides are talking about preparation of your proposal, and then you submit. So what happened after you submit? Our secretariat staff will check whether it's complete or not according to the type of research, type of researcher. Okay, and then it will be reviewed by the chairperson whether to decide whether this is exempted, expedited, or full board review based on the sets of criteria. Okay, and then the person who review the panel chair or chairperson will decide, will choose the most suitable reviewers based on our member list and independent reviewer list. Okay, except for the undergraduate project, there will be different pathway. So these are the criteria that we use for expedited as opposed to full board. Okay, all right. This is for expedited. Okay, this is for expedited review. Because for expedited review, the session is only attended by 2%. Okay, 2%. Right? Researcher may be called or not to the meeting, but supervisor should be present when they are called. Okay, and not only student. This is, we make it mandatory for students. Supervisor or supervisors must be present. At least one supervisor. Okay. Okay. What happened if let's say the proposal is assigned as expedited review, and a reviewer has been assigned and they forwarded, they submitted the review within 2 weeks. Then based on their recommendation, that it is during the expedited review, either the PI being the researcher being called or not, then we decided. If both review says approve, then we approve. Is if one person select approve, one person select minor revision, then it can be a minor revision. If either of the reviewers says more than minor, which is major revision, then it will discuss again in the full board. And because this is what we want to be fair for the researcher, any unfavorable decision made by reviewer should not be the only person who decide. So it has to be discussed with more members so that it is fair. Okay, so it will be discussed in full board. So that is why it is important for students to prepare as the best as possible the proposal. Okay, not the very raw one. Okay, in contrast, for full board, you see the research is much more riskier than the expedited review proposal. Okay, and it will be attended at least 7 Japan members. And you know, the more number, the more challenge to ensure the number of the timing of the meeting. Okay, even though we have meetings expedited plus full board almost every 2 weeks throughout the years. Okay, every 2 weeks. Okay, so these are the criteria that we use. Again, researcher may be called, not to call, depending on the clarity of the research proposal, that document that we send. And again, supervisor must be present for students' presentation. Okay, so these are the basis when we decide whether it's expedited or full board. Okay, all right. When it's called, don't feel disheartened. The reason is called because we want to facilitate. We want to help the researchers so that anything that require more complex explanation, sometimes it's not clearly explained in writing. Okay, so that we can discuss that and then what are kind of decision to be made. Our role is facilitation. Okay, so this is the job of primary review. Okay, you just browse through. This is what they use. Again, same thing: beneficial, non-beneficial, autonomy, fairness, justice, and they make recommendation to be either expedited or to be discussed in the expedited review or full board review sessions. Okay, so this is common question. You say, why Japan is particular about method? Yes, it is part of the requirements and what is the best practice of the committee to look into 2 components: the scientific soundness of the research and also the ethics component of the research. So 2 aspects have to be clearly demonstrable that it has been reviewed, because wrong technique will produce wrong result and unnecessary risk to a subject. It may not be publishable, or you publish by rubbish. The worst thing is if you publish and you provide wrong information to policymakers. In the end, okay, the community will suffer. That include you and your family, and of course, you waste money, time, effort, and so on. Okay, so to add more what do you call reason why, because even if you go through this, even this quite old article, it really emphasizes on the requirement of social scientific value, the valid scientific component, and fair subject selection, and so on. The scientific component is really important to be considered that research is with good ethics. Okay. So, and even in Malaysia, there's an initiative under Academy of Science, National Science Council, sorry. You got the integrity of research. Right? So you can see the reliability of performing research, objectivity, right? And even the integrity of the data, talking about data management, research expertise, and necessary equipment. And as you can see here, should not be pursued ad hoc. It should be planned carefully, not last minute kind of research proposal. So these are the same thing, expedited meeting, this full board meeting. So so decision is made. This is actually repetition, sorry. Okay, so what happened if either full board in the full board, if they require modification, then after the meeting, they should you should submit the revised version addressing every single comment that was made to your proposal. There will be an official feedback that's produced within 14 working days. Kenapa lama sangat? Because the secretariat, that is also the meeting punya secretary, will have to go through every single discussion, verbally or written. That only kita translate into this feedback. So that's why it require checking, because this will be reviewed by the authority when they come review, inspect us or survey us. Okay. You can always rebut recommendation with good rationale, with reference and so on, right? With respect. Okay, this is example of the comment and we have to address. Okay. Okay, another pause before we go to what happened after, if let's say you have submit and your research is approved. Or almost 1 hour. Okay, we have gone through about the 60% of the slides already. Okay, so what happened after submission? Let's say you get approved. So what we do, even though in the meeting we do not normally declare whether it's approved there and then or not, because once you finish your complete your presentation, discussion, and question and answer, we let you go off. All right, and then the Japan member in that meeting will deliberate based on the question and answer and so on. Then we decide without your presence whether you belong to either approve, modification, resubmission, rejection, and so on. So let's say it's approved, then you provide the letter, and the approval is only for 1 year, even though your research go across 5 years, for example. Internationally standard, it only maximum 1 year. And then what happened after 1 year period expiring, then you send what we call application for extension of study or continue review application annually. Okay, why? Because it is required to have some check on the progress. Okay, it is mandatory to use this what they call statement, information, what they call requirement, in which you can only use the latest approved protocol in your study. Kalau ada amendment, you cannot execute yet the amendment yang you revised, except when there's urgency to save patients' life and it has to be clearly documented. This one we call it protocol deviation. It is acceptable, but not every single situation. You have to really justify of doing this. Okay, this is to make sure that the protection for the participant. So kalau ada amendment, you need to make sure it's justifiable, whether it's minor or major. Minor ni contohnya administrative change of address and so on. Adding ni ataupun adding what they call new researcher which also qualified. Extension ni yearly, then final report, okay, and so on. So why we bother about post-approval? Because apart from it is required by international standard and FRCA and also MPRA, but if you look into perspective of researchers and ethics, for ethics committee, at least we know that there's an ongoing compliance of that research. Participants also being protected and the integrity of data, and there are certain situations that we may have to adapt, right? Like it or not. Contohnya the COVID, this is COVID, and those last time disaster, flood, for example. Okay, and even similar thing to in the perspective of researcher, it uphold the research integrity of and provide a good reputation reflection of professions on the researchers, and also it minimize the risk towards researcher and also institution. So when we talk about protocol amendment, as I said, any amendment can only be executed if approved by EC. So use this form and it will be reviewed on whether it's justified or not. If it is, whether it involves any change in risk or not. What kind of risk that have changed. Low risk, high risk, and so on. And it will be discussed accordingly in expedited review session or full board review session. Okay. Then bila dia discuss, and then it will decide whether to approve that amendment or not. Okay. This is about contributed application. As I said, maximum approval is 1 year. And then every year it should be the researcher should send what do you call? We try to have this component because so many research. Inshallah, by if our online system secretariat module is up and ready, then it will be automatic reminder. Okay. Okay. And the final report, it is something that many researchers forget to do. They say, oh, final report ni macam publication article. No, that's different altogether. Okay, final report is just one page, like this. So we want to make sure the number of participants recruited and in the beginning, in the end, how many percent left. Okay. Because there's maybe some withdrawal, okay, a patient terminated from the study and so on. It has to be reported. Only one page, okay, not many information. And this is about protocol non-compliant, as I said just now. Okay, use this form, okay, because it is required as international standards. If there is an issue need to be addressed, then maybe site visit will be performed for that particular research, because we have to make sure that the subject is well protected. Okay. Protocol non-compliance, and then review, and then we decide whether we need further information, including site visit, report, and so on. Right. So JPM may opt for withdraw the ethical approval if there is a fraud or very serious safety issues. For example, repeated consent form has been what they call skipped. All right. Okay, then is a big issue, okay. All right. Okay. So it's not, we don't want this happen. So same goes with when you have early study treatment. It's not something criminal, but it's important because we want to make sure the reason of early termination, because it is well accepted sometimes, especially kalau ada multi-site research site tu, because probably not economical anymore if the recruitment is so low and so many sites to recover. Sometimes the sponsor will decide, okay, that side maybe we have to terminate recruitment process. That's fine. And post other things that the complaints we do have to accept, entertain, and it will be managed accordingly to the standards. We've discussed in the full board or expedited, depending on the degree and severity of the complaint. And this is the severe adverse event reporting. This is basically in interventional study lah. Because what is more important is patient care. Whenever there is a serious adverse event, so you don't have to report to ethics immediately, but for sponsor they need to be informed. Kalau sponsor trial lah. But for us, if it's, and this is international recommendation, if the SAEs, the other certain criteria, you have to read about what is SAEs as compared to AEs, and how is it different from what we call adverse reaction. Okay, SAE kalau on site, maknanya in USM within 7 days you have to submit. Kalau off site, kalau multi-center, and the SAE is happening to patient outside USM, then it's okay, you can pull and send every 3 to 6 months. This is our SAE committees and the site visit. This is what I mentioned about SAE. Site visit, we don't like, we cannot do ad hoc site visit. We have to inform the research team they're going to visit. Biasa kita bagi 2 weeks notice so that they can gather around their staff and so on. Okay, you select, these are the criteria to select site visit. Okay, and then the subcommittee will fill up this form and to present at the full board meeting to be discussed. Okay, this is special situation research in which a special situation in research. Number one is many question came to us. What if there's international student from China, from Japan, from Indonesia that enroll in the postgraduate studies USM and they want to research, but the research is basically at their home country. Still, you have to get approval. As I said in the USM policy, if the student is the researcher, even though the study is only done abroad, they get approval first before they start any research activity, right? Plus the ethics approval of the locality. Some students say there's no ethics committee in theirs. They may have not looked enough. They should be there, even closer to, maybe not particularly in the institution, but maybe the closer to that it can be used and their approval. All right. So disaster research, yes, this is happened during the COVID, during the huge flood disaster in Kelantan last time. So there's a special pathway. There will be no primary review, so we collect 4 or 5 projects together, sit down there, and then will be reviewed by experts. Okay, the research. And for undergraduate research, of course, you are postgraduate. So undergraduate, they can be also done by group in terms of review, but they have to be presented at the department level first, and it should be low risk project. And there's also special arrangement for certain short candidature master program, for example, yang 1.5 year. So we do entertain, but it had to be pre-arranged, not something ad hoc manner. So this is another comment, same thing. Okay, I think I have it earlier on. So kalau if required outside USM prior approval, yes. Okay. If a study as a unless if let's say you do at an institution where the institution doesn't have their own ethics committee and they endorse whatever decision by Japan, then you don't have to go for another approval. Okay, so these are the reason why we say that you require. because we know, and me myself as one of the so-called dipanggil surveyor or auditor for other ethics committee, and I've been appointed by FERCAP, SICA FERCAP as a reviewer together with a few, 4 more of us in ethics committee to survey international ethics committee in the region as well. So this is the timeline. Okay, so important to note that the timeline, this 6 weeks for expedited review, 8 weeks for full board is basically the first, it started when the time you your submission has been verified as complete submission until the first decision. Because first decision too, after first decision too may require you have to do modification. So the time that 6 weeks and 8 weeks is basically from the time you have submitted a complete proposal and is verified until the first decision has been made. And that is what we call the 6 weeks and 8 weeks. Okay. All right. So in conclusion, Japan USM is an IRB that is approved and accredited for USM by locally and also been what they call recognized by international standards. Okay. Our role is to facilitate. Okay. Any question? Any question? I feel like talking to myself. Maybe I should quit.
And thank you so much for the presentation.
Who is that?
If you could.
Sorry? I can barely hear your voice. Can you
Hello,
come
Doctor.
closer to mic? Yeah.
Hello, Doctor. I'm Sana Yasin.
Yeah.
Thank you so much for the presentation. It was all the informative. So I wonder if you could just hand us this presentation from Leo, or just send us the presentation to if we need to. Yeah.
Can.
Thank you so
no
much.
problem.
Thank
No
you.
issue. Right. Are you sure that you have no questions? Are you clear on the requirement of submission to Japan? What kind of research determined as human research? The criteria of research that require submission to Japan and other ethics committee as well, right? For example, Ministry of Health. If you want to collaborate with University of Malaya, for example, then you have to get both approval as well. Any one of you are also staff USM? None. No. Okay. All right. Who is Leo the Great, basically? Is it Dr. Tam? Are you?
No, it's me, one of the students here.
Okay, Leo the Great. Okay. All right. If there is no question, that's it. I guess I will email to Cik Muhammad. Siapa dah? Cik Muhammad apa nama? Lupa dah. Cik Makno. Cik Makno, my slide. Is it okay? This group is quiet. Last group, I remember they are quite interactive. Okay. I hope you really enjoy and benefit from this session. Hope I helped you a lot. It helps you a lot in preparing your proposal. The most important is to get it discussed at your department and note down the comments and address the comment, right? And make sure you document you get the list of attendance and the document, the comments made, and the response that you made to each of the comments, and submit all together to Japan. Okay, thank you very much. That's it. Thank you. Good luck. Bye.